Good morning.
As morning draws near, I rise and say my prayer. Little piece of bread to my mouth, little tea to wash it down. It's my daily tribulation, even though I'm a working man. I work so hard to make ends meet, with one suit and one shoe to my feet. Days are getting so hard, yeah, but I got to keep on pushing on this 9 to 5, working to.
I'm Al McFarlene. Welcome to our special edition of Heart to Heart Conversations. We've got this great series of programs where we bring people together to contextualize our experiences that have to do with heart health and whole body, mind health. And today is a continuation of that. I want to begin the program by introducing the instigator, along with Batala McFarlane, Dr. Courtney Jordan-Baechler, and she's been just wonderful, she and her colleagues, in responding to real-time, real-life stories that we bring about things we experience and how that relates to the heart and beyond. Dr. Courtney, how you doing, first of all?
I'm great. Thanks for having me again. It's good to be back, and I love your background there. It looks like you've got some of your grandson's drawings or something.
That's really right. Yeah, he's the car buff, so we're glad to have that. Thank you. And so today, Dominique Wells is here and Clare Rodrigues-Henderson is here. And the topic for today, and this is really news for me, the topic is pre-eclampsia. And let me start by asking you to describe what that means. And I had to stretch to figure out how that related to heart health. And I've learned so much, and I hope that this conversation will bring stories that teach us all about how all of these issues are related, interrelated. So explain what it is, first of all, and then I'll ask you to engage with Dominique Wells and Clare Rodrigues-Henderson to hear and tell their stories.
Absolutely. So yes, I'm very excited to hear from you guys because you really have the most critical piece of how you have experienced this. But so preeclampsia is one of the diseases that can develop in pregnancy that we associate with high blood pressure development. So usually it happens after a woman is at least 20 weeks pregnant. Usually it's not associated necessarily with having high blood pressure before that, and it's a much more sudden increase in high blood pressure. It's also associated very commonly with the development of protein in the urine. So we do a urine test to find that swelling in the body that way. And it's, again, this very quick onset or timing of it happening in pregnancy. The research has shown that it can happen because of the very inside of the artery, or what we call the endothelium, that's not functioning right during that time. And we see that in heart disease too, and particularly in women with heart disease. So we've actually found correlations with preeclampsia and the development of coronary artery disease or heart disease. And so that's why it's such a particularly big topic, because I'll be curious to talk to these women, but very often it's not something that's discussed that way. And it actually can even develop after your pregnancy is done, 4 to 6 weeks later. So there's really not a ton of information out there. And unfortunately, this is something also where we see a lot of disparities in outcomes and diagnosis in our brown and Black populations also. So I would love to hear from you guys about your experiences.
And before we do, let me do two things. One is say that Dominique is my granddaughter, and I love her dearly. And I remember, Dominique, in your pregnancies, that was something we discussed, right? Preeclampsia, and your aunt Chrissy, same thing, preeclampsia, right? And so that's something that has been part of the conversation, and part of it in a way that what it really meant to me as a grandpa, and as a dad, still didn't really register deeply. So that's why this conversation is so important to me, because I think people need to really see and feel and understand the gravity and the consequences here. So with that, finally, let me thank my other cousin, Phil McFarlene, for the opening music. I hope you like that. Hope it worked for you. Sets the mood for us being together today. Dominique, go ahead.
Yeah, well, thank you for having me. This is an amazing topic that needs to be discussed because prior to my pregnancy, I was not familiar with it at all. And it came out of nowhere. So basically, my feet started to swell crazy. I mean, I couldn't fit any shoes. I wore slippers every day to work, and I couldn't figure out why. I thought it was a part of the process, being that this was my first pregnancy. And when I expressed that to my doctor or my nurse at the time, she just kind of brushed it off a little bit as it wasn't a big deal, or maybe I should watch what I eat. And I'm a fairly healthy person, just in general. And so it got to the point where she said, let's test you. Let's see what's going on. And I did a urine test, and then we found a lot of protein in my urine. And then she monitored me for a little while, but the swelling continued to grow, and it was so uncomfortable for me. Then after that, maybe about a week or so later, after the monitoring, my doctor came in. I had a routine checkup, and my doctor came in and she said, "We're over this. You're going to have a baby today." And she brought me across the street and to the actual hospital. And, my child was, delivered shortly after that. But it was, the experience for me was not that pleasant because, as you mentioned, Dr. Courtney, that it happened so fast, so I missed out on a lot of, I think, vital pieces of my pregnancy, maternity shoots and things like that couldn't take place because my daughter came early. And, I wasn't even able to pack my hospital bag, because I wasn't expecting this to be the experience with my first child. Um, and it wasn't discussed, properly in my opinion. I was put on, I don't know the exact name of the drug for blood pressure. It was a blood pressure pill that I was prescribed for about a week. And then after that, went back for a checkup and everything kind of stabilized. But that was it, long as it was stable at that moment, everything seemed to go back to normal and it was okay. But the aftermath, I never knew that there could potentially be anything that came after that. And so that was my first child. And then with my second child, I developed pre-eclampsia as well. It wasn't as severe, but it was very similar, the duration for each pregnancy. So then both of my kids came a bit early, spending the weeks in the hospital and the NICU, that is it's a hard thing to do, when you're not able to take your baby home right away. So that was my experience. Afterwards, everything normalized and stabilized out for me, thank God. But, I know that there are some people that may not be as fortunate as I was.
Mm-hmm. Yeah, well, thank you, Dominique, for sharing your story. And I'm excited to hear from you too, Claire. I just want to touch on a couple things that you highlighted, which are so important, that with preeclampsia, it's more likely that you would have an early birth, as you highlighted. And then the big concern that we really worry about is stroke, and how we make sure that we prevent a stroke from happening with the blood pressure getting too high. And I think some of the other pieces that we'll definitely talk about further after Claire has a chance to tell her story too is just how important this information is to get out. And like you said, this is supposed to be this really exciting time of your life, and how, you know, we do a better job of putting you in the driver's seat so that you know what and where and what to expect, ideally before, but definitely if something surprising does happen, you know, what to know, who to ask when, and what to expect, medications and otherwise, I think is such a big piece of it. So, but thank you. Claire, tell us about you.
Hi, everyone. Thanks for having me. And Dominique, thanks for sharing. So much of what you said is so reflective of some of the same experiences that I had. So it's a bit of a trip down memory lane, and not too pleasant memory, having had some of that. But like you said, Dr. Courtney, it's such an important and critical conversation to have. And so I've had the opportunity to have this discussion today and hopefully increase awareness about preeclampsia. And I honestly had no idea that there was even a link to heart disease. So that's definitely piqued my interest as well. So I am a mother of 3. I had preeclampsia with each of my children, and they all varied in how severe they were. And with my second child, I had HELLP syndrome as well. But with my first pregnancy, I started to notice symptoms probably about maybe about 25 to 28 weeks. Maybe a little bit later than that, it starts to all kind of blend together. I don't know the exact time frame, but I just remember feeling really like my face was starting to get puffy, and it was more like an overnight sort of change to my face and my appearance. I started to have what I called sausage fingers, because my fingers were just really puffy. I couldn't bend them. I couldn't wear my ring anymore. And I also started to have what I think some would describe sort of like starry vision. So if I closed my eyes, I could see, you know, stars. So I tend to be an information gatherer when I'm trying to figure something out. And so I took to the internet and started searching and trying to figure out, what is this in pregnancy? Why would I be feeling this way? My first inclination was not to reach out to my doctor. I think my experience has often been that I have to come and make a case before something is taken seriously. So I felt like if I had more information and some, if I could back up what I was experiencing with some evidence of some kind, that I would be taken more seriously. And that seemed to somewhat do the trick. I ended up calling the clinic and explained to my doctor what I was feeling. Eventually they, they checked my blood pressure and things like that. I didn't have any, I didn't have high blood pressure or anything like that, or nothing that was too alarming. But what I've realized about preeclampsia is that things can change so quickly. And so, although I didn't have any high blood pressure or protein in the urine at that time, I happened to have it again. I happened to have a follow-up visit the following week, and things had changed quite a bit. And so at that point, that's where things got a little more serious, and they started paying closer attention to what I was experiencing. I was fortunate, I think, in that this wasn't my first pregnancy. I had a pregnancy loss at 17 weeks with my first pregnancy. And so given the nature of that particular loss, I had already been sort of on that maternal fetal medicine radar. And so I think that really helped with this pregnancy, with my first preeclampsia pregnancy. So it was immediately considered a high risk pregnancy. And so I had additional eyes on the situation. What ended up happening was, it seemed like, things were going okay for quite a while. I didn't have to take any medication or anything like that. But as a social worker, a community social worker at the time, I was really busy and just very active. And so it was recommended that I do sort of a modified bed rest. And so ended up having to do a lot more, just working from the office, not really getting out as much to see clients. So really scaling back on some of those things that was maybe adding to my level of stress. I made it to about 35 weeks, and then, much like Dominique was explaining, went to the doctor, and they realized that, with each visit, the fluid in the placenta was getting lower and lower. And so it finally got to that point where there was really very little fluid left. And so the doctor just came in and said, "Are you ready to have a baby today?" And I really thought they were joking. And it didn't initially, it took a minute for me to register. And ended up I was fortunate enough to go home and try to gather some things and head back to the hospital to deliver the baby. So my first arrived about a little after 35 weeks. And with my second, it was, symptoms started a lot sooner. With my son, it was, my legs were swollen really badly, and couldn't put on shoes. I mean, I had those like big, wide UGG type boots, and I couldn't even get my feet in those. It was just really significant swelling. And again, it started really early, actually. It was probably about 20 weeks. And so it seemed like the severity was just that much more. So the swelling of my legs, all the way up to my knees, my hands, just everything was swollen, and definitely started seeing the high blood pressure show up a lot sooner and really consistently. I ended up with that pregnancy, things just moved so quickly and really intensely. So I was at the hospital at labor and delivery quite frequently, trying to monitor things. My liver enzyme levels had really escalated quite a bit, and just a number of other things that they were trying to get under control. And eventually, I think for about 1 week, I was hospitalized, and they were, trying to figure out what they're going to do. Should I deliver? Shouldn't I deliver? Because I was only about 30 weeks at that point. And so there was a lot of hesitation to do the delivery at that point. But they ended up just doing all the, giving me the shot for the baby's lungs and all of that kind of thing. But actually with things, the levels came down, my blood pressure came down, and they ended up discharging me. And I remember being really reluctant about that. But it also wasn't my usual OB that was caring for me. And I do feel like if it was my usual OB, it would have been a different experience. I got home and all my stuff was still packed, and I didn't last long. I got home and maybe slept for about 5 hours, and then I woke up thinking I was having a heart attack, because my chest was tight, my left arm everything on my left was going numb. I was just having this really difficult time breathing. And I don't remember too much after that point. My husband ended up taking me to the hospital, and they admitted me right away. And I ended up having the baby soon after. And just real quickly, with my third, it was a different experience. I had gained enough information just from the maternal fetal medicine doctor, and also having time to do more research and learning from the first two experiences. What are some of the ways that you can, I don't know if it was going to be possible to prevent preeclampsia for myself, but I ended up having some additional ways to sort of tackle it. And I ended up having it anyway with my third and final baby. But it wasn't, I was able to deliver her at 37 weeks. And the symptoms were just so much more mild. And I was able to keep it at bay for quite some time, thankfully. So that experience was a lot better than the second one and the first one.
Wow, Claire, so much there that you shared.
I know, sorry.
No, it's wonderful. And I hope I didn't cut you off, Al, but just a couple of things that I wanted to touch on that definitely have been themes. And one, it just breaks my heart to hear you say that historically you've had to kind of do researching and stuff first to kind of come in with, ammunition of why there is something wrong. Because unfortunately, that's something that we hear commonly. And it just, where you contrast that with your third, right? And what a different experience it can be when we have trust in the person on the other side, right? When you can actually trust that the provider clinicians there to have you have the best outcome. And so that's certainly one of our huge goals in this process, and would be curious in both your thoughts and Dominique, what we do better to enhance that, or how things have maybe changed that way. And then just would congratulate you on everything that you did with your third. It's not always preventable. Like you mentioned, pre-eclampsia isn't always, something like traditional high blood pressure, if you will, that has potentially more to do with lifestyle. Pre-eclampsia is, I've seen the healthiest, most resourced women develop pre-eclampsia. And, but like you said, again, having a playbook of what to do when, and knowing that you are justified and right to get more help is really key.
I was thinking, Doctor, that the similarity between what Dominique and Claire said about having to make their case to their physicians. And I think you've mentioned this in the past as one of the challenges of modern health is to become more culturally sensitive and aware, to operate with a sense that one standard of understanding does not exist for everybody, and that there is a need to take all women, all patients seriously, but there is a history of the institutions, the professions, not doing that when it comes to women of color. So why is that? What has been the case, Dr. Courtney? And I'd like for Claire and Dominique to talk more about their feelings about the need to almost be on a combat footing when you go to get service that should be inviting, welcoming, illuminating, illustrative, and affirming in every element. But that's not always the case. Maybe I'm overstating it, but Doctor, what do you think?
No, I think unfortunately, what you're describing is very accurate. Prior to this current role at the Heart Institute Foundation, I served as assistant commissioner at the Minnesota Department of Health. And one of my favorite roles there was co-chairing the Minnesota Maternal Mortality Committee, a review committee, where we went through every single death and disease that happened with moms in Minnesota. And unfortunately, when you look at those, they're way disproportionately African American and Native American women. And I'm still on the review committee now from a cardiology perspective. I'm not overseeing the work anymore, but we had all these conversations at the time of how low could we expect to go in reducing preventable death in our African American and Native American communities. And it was such a frustrating conversation to have because it's possible. You know, we're not talking about accidental things. We're talking about things that we, in modern medicine, we have treatments and cures for. So, it leaves us with the fact that historically we have things from the Tuskegee trials to as late as the 90s, where there still was research at acclaimed institutions, horrible research that shouldn't have been happening in African Americans. I am hopeful that in 2021 and a bright light that has come from something as horrible as George Floyd's murder, that in my area, I see more attention and interest than ever in calling a spade, in recognizing systemic racism, in recognizing access, literacy as it relates to healthcare knowledge, and really not just talking about the problem, but having solutions. But hence our interest in being here. It is only going to be successful if those most impacted define how it is done. And that's why I think, hearing from, both of you, Claire and Dominique, about your experiences is so critical.
So, Dominique, how worried were you personally for your health? I mean, so Dr. Courtney talked about the statistics, and those are frightening enough when you discover that there is documented discrepancy. But on a personal level, you as a Black woman going through the experience of having a child and discovering the eclampsia, did you become personally worried about that? What were your thoughts as you went through the process? The real question is, how do you put your experience against the statistics that show you were at greater risk? Are you thinking about that or not?
Good question. So I didn't know anything about preeclampsia prior to, me being diagnosed with it at the time that I was. And so it wasn't something that I was familiar with or that I could have said, correlated like my symptoms with what was going on. So, for me, it was super frustrating that I wasn't being taken serious, as Claire mentioned. And, that's how I felt. I felt like I was just being overlooked and that my symptoms or my concerns weren't of, concerning for, the nurse that I was seeing. And it made me stop scheduling with her in particular because I knew that something was wrong. And so when you speak about the statistics about, more women of color having the deaths, increased death rates here, it makes sense because I hate to put race in it, but I was seeing predominantly Caucasian women, and in a world that it is now, where me as a Black woman, where I at times feel undervalued as it is, to have that carried over into the medical world, that's kind of how I took that. I took it as if me being a Black woman, I'm not being looked at, with the same respect or, in the same light as I would if I were a white woman. And so there was a lot of trust that was lost. And that was hard for me. That was hard for me to deal with because in my head, I said something could have been done. Something could have been done to prevent this. And even though, learning as the years, went on that this isn't always a preventable, disease, at that time. But, going through the process for my first time, I definitely thought that. And it, changed my whole experience. So the correlations, it makes sense now why the statistics are what they are.
So Claire, same question for you. You described yourself as someone who does research all the time, who tries to find answers and to be prepared. And describe again the feeling you had that you had to present your case, number one. And then as you developed research in the first and second and third pregnancy, were you also conscious of the statistics, of the failure of the industry to protect you, or at least the evidence that Black women were having outcomes that were different from the general population, and that in and of themselves meant you were at greater risk for negative outcomes? What do you think?
I think whenever I have discussions with others about preeclampsia and hear so many stories from other women that have had this condition, especially women of color and especially Black women, I'm often, even reflecting on my own experience, I have such a range of emotions about it. Because like we've been talking about, it is preventable. A number of pregnancy-related deaths are preventable. It's not something, significant. It's things that really, it's been about how it's managed. And I think that's been something that I've always reflected on as well in my experience. I think there's definitely times when I think about it and I think, well, this really could have been prevented. This wasn't, I shouldn't have had to go through the steps that I did. And even though I think I had a pretty good relationship with my doctor, there's so many different people that you encounter when you are pregnant. And just because I had a good relationship with my doctor didn't mean that the nurse I'm going to speak to has that same approach or the same level of respect or values what I have to say or takes it seriously. And then depending on who I spoke to, it was really about their level of experience or knowledge about preeclampsia and the ways that it presents really determined which way things were going to go. There were some doctors that I would have to connect with, especially when my symptoms were just sort of all over the place. And I was at labor and delivery just about every week, it felt like, towards the end. It's like a new person I had to explain things to. Sometimes they weren't looking at my records. Sometimes they weren't looking at, well, what's the history of your enzyme levels from last week compared to this week? And it was just really, I just remember feeling so frustrated. I, as a social worker, I would see this happening to the folks that I would work with. But because it was me, I don't know why I didn't have that same inclination to advocate for myself as strongly as I should have. But I think just even from the first baby that I had preeclampsia with, it was really such an eye-opening experience, trying to find my voice and trying to figure out how do I approach this and not feel like I don't have a voice or I don't have a say in this. I think we often trust our medical providers to really be the most knowledgeable and know what they say is what I need to sort of abide by. And though that might be true in many cases, I found that it wasn't always the case. There were times where I felt like things were being overlooked, and it was okay for me to bring it up. And if they weren't going to listen, then I would bring it up with somebody else. And I think that's what sort of led me to gather all this information and feel like I had to make a case. I think the other thing too that, in terms of systemic racism, and I think I often reflect on why was my experience so different. Than I have a best friend that is from Liberia, and she was completely ignored. And it's really by the grace of God that she's alive today and that she was able to deliver her baby, because her experience was so different from mine, and just much, much worse. And so I often reflect on, well, what was that about? And I think I'd be ignorant if I didn't acknowledge that, when it comes to discrimination, if you're lighter complected, even as a woman of color, you're treated differently if you're darker skinned. And I think that's definitely something that may have played a role in why my experience was so different from my friends. And I think that's, just the reality of the healthcare system, especially, that there's still racism that permeates the way that providers deal with you, the way they approach the situation. I think Black women are often seen as, oh, you can handle it. Oh, that's normal. Your tolerance for pain is so much higher. And so there's this delay in responding. And this delay is really what leads to things going south so quickly, and leads to the higher number of deaths, I think. So I think it's just when it comes to considering equity in healthcare and the way that it's delivered, I hope that there is going to be more of an intentional look at the role that plays in the way that services are provided and the outcomes for women, especially for Black women.
Well, I feel like you could be writing a book here, Claire. There's so much, and Dominique, but that there's so much that you're both saying here. Our dear friend, Dr. Rachel Hardiman, who's local here in Batala, knows well, just had a great study published and talked about in the New York Times about how Black women who receive care from Black physicians have better outcomes. So we know, unfortunately, that is true in 2021 still. And so I think one of the things, and we all know Serena Williams' story, right, of how you talk about just how, I don't know, I cannot explain how it gets there, but this assumption of pain thresholds and, to even having a pulmonary embolism clot, which is what Serena knew she was having, and just in the nick of time got treatment. But so for me, as I live in this world on the clinical side of how you start to break that down, obviously there's lots of efforts going into filling the pipeline and having more providers that are representative of the communities we serve. So we know that's a piece of it. There's great work on doulas and community health workers. Like you said, it's not always just the physician, but having a trusted resource that is somehow connected that you can relate to, talk to, be honest with. But for me, the other piece that is hard to not believe is part of the piece in 2021 is, with technology being what it is, how do we put in your hands quickly sort of the algorithms that are going through our heads of, if your feet swell this much, if your blood pressure is this much, if these types of things to level those that health literacy piece a little bit, so that it's easier to know. You don't have to spend your time digging for this type of stuff, but these are the things that you should be able to say. Are you confident I didn't have a pulmonary embolism? Are you confident I didn't have pre-eclampsia? Because sometimes I have found that when a patient says to you something like that, it sort of clicks you out to perhaps some of the bias that was happening there. But I at least for me, that's been one of my goals is, anyway, how do we make that in your hands quickly? Because some of the other strategies that we have are taking a long time to have providers that look like our community. It's going to take time and stuff. How do we start to break that down faster and in a more even manner? I'm curious what you think.
Well, honestly, just, seeing different providers over the time, something that I've noticed is, us women, we know our bodies, especially for, reoccurring situations, whether, it's yeast or whether it's, things like that. And I've found that when I go to my providers and say, this is what I'm experiencing, I'm pretty sure that it's this, but, let's test to, just to double check. And a lot of times I get shut down right there. Hold on, slow down. Let's do the test first, and then we'll check to see what it is, as opposed to, appreciating the fact that I'm understanding and I'm paying attention to myself to know that I can Google these symptoms and say, this is what this is. Please check for these, or, this symptoms, or please check for this, or test me for this. And it gets frustrating because a lot of times I get shut down, immediately. And that was the same thing for, preeclampsia as well. I got shut down immediately. And, it's hard to, like I said, build that trust and to keep it going. But with this being so common with women, especially, in pregnancy, I feel like it needs to be something that's brought up immediately. These are the particular things that you might experience, and allow for the patient or the woman to say, or to at least have some type of understanding of what it is, so that, kind of preparing them for what can come. It's great if it doesn't, that's amazing. But how can the women carrying children be more equipped to deal with this, prior, as opposed to it being on the back end? How can you combat it right at the forefront? Because I know that would have been something totally different for me if I even knew what it was, or that it was even possible. A pamphlet would have, that would have been given to me, when I found out that I was pregnant, would have sparked me to do my own research, to find out ways that I could, possibly prevent it. With my second child, it was brought to my attention that if I take baby
Aspirin.
Tylenol or aspirin every day, that, it would lessen my chances or my symptoms. But, if you're a holistic person and the baby aspirin isn't a route you want to take, which it wasn't for me, how are ways that, you can find something, comparable, that's not, an over-the-counter medicine of that nature, but that information didn't come until, like I said, my second child, until even that was, further down my pregnancy, not quite the 20 weeks, when it's usually diagnosed, but, things like that. So that was a big thing for me. How can it get talked about in the forefront as opposed to on the back end?
Agreed, Dominique. I think the preventative nature of things really should guide a lot of the conversations. I think when you have those initial appointments, in your pregnancy and even throughout, I think it's so important to bring up, monitoring your blood pressure, provide a blood pressure machine, a home one, and, get into the habit of checking blood pressure and really paying attention to what are some of the ways to mitigate some of those symptoms if they do arise, and what do you do when you do start to notice it. I think one of the misconceptions that I've always had about, and I think that has been given to me by medical providers, is that when you have preeclampsia, the solution is to have the baby and then it's done. And that's just not the truth. There's these long-term effects that I'm still learning about. And I think that's also something that needs to be a part of the conversation postpartum, is, not just those first 6 weeks where you could still be eclamptic and, have a seizure or some of the other symptoms, but beyond that, including the information about it being the linked to heart disease. Like I said, that was not something I knew about. So there's just a whole lot of, a lot of information and education that I think could be happening. I've reached out to other women that are pregnant, people that I know, sometimes people that I don't know. I'll still, talk about being aware of some of the symptoms. I think sometimes the symptoms of preeclampsia are so what's seen as, oh, those are just normal pregnancy symptoms. The swelling is normal. Don't worry about it. But to what extent is it normal? And when is it not normal? So I think that information is also helpful to know. And then I think also it's always been a reminder for me to pay closer attention to my health. I don't like taking medicine. I don't like taking pills. I won't even take Tylenol. I'll have like the worst headache for 2 days straight and I won't take it. And I think that is just the way I am. And so, if I think that's something for providers to consider as well is, like you were saying, Dominique, what are some of the, if someone is more, has a more holistic approach to their healthcare and health management, what are some other avenues and ways to address the symptoms? And I think also, Dominique, you brought up something earlier on in the conversation that I think sticks with me, is that you mentioned that because of the way you were treated, you didn't do any more schedule follow-up visits with that particular nurse that you were dealing with. And from what I understand about preeclampsia, that's such a big reason why you don't have women come back to the clinic. And so then they only seen when it's really late, and then there's not much information available about their pregnancy to the providers. And sometimes that can be a reason why there may be more significant issues with the pregnancy and the delivery. So I think I think as far as technology goes, I think just being mindful of women of color and Black women's experience and really looking at it through that lens is really important. And I switched to a provider that is also an African immigrant woman, and I think that made such a big difference in the way I've been able to navigate, healthcare, and I feel a lot more comfortable navigating healthcare and going to appointments and bringing things up. And I think that makes such a big difference. And I would encourage other Black women to do the same, as to seek out providers that look like you, or that at least have that same lens and experience. It makes such a difference.
Claire, you mentioned your concern about immigrant women. That's another dimension of this.
Mm-hmm.
You talked about your best friend, a Liberian. You talked about colorism in our community. But you are an immigrant as well, right? So part of your story and how where you originate has, in one way or the other, either improved or had a negative or consequential or inconsequential effect on your engagement with the healthcare system.
Mm-hmm. Yeah, so I was born in South Africa and moved to the United States when I was 12. And for those who know about South Africa's history of racism and apartheid, not being white, often meant that you were dealing with a lot of the systemic issues and racism that we have seen here in the United States as well. It just was happening much longer and didn't really come to an end until about 1995, even though the ramifications continue. But I think as being an immigrant, I think, there's so much information that I don't have, that I don't know about, especially for people of color in South Africa. There were so many things that were just not documented or considered important enough to even, if you weren't even considered human for many of the Black South Africans, There's a lot of information that you don't have access to. There's not, so it's been a learning experience for me as well, especially with regard to preeclampsia and my own health experience. And I've had to do some of my own research on the side to see, well, what's my predisposition to this condition? I moved from a country that is often very sunny, and I spent a lot of time outside and had that vitamin D. And I'm not getting it here in Minnesota by any means. And so that is linked to preeclampsia as well, low vitamin D levels. And so, that's had to become part of my regimen, which I really do feel played a role in why my third pregnancy went as well as it did. Even though I still ended up with preeclampsia, it really was so minor compared to the other two. So for me, it's just been trying to learn more about myself and my history and some of the role that racism has played and the lack of care and that sort of thing has played in how it shows up for me now, all these generations later. And so, I think it's just something, we have to do a lot to sort of understand ourselves and really reflect and look back on where we come from and what some of those factors are that play into how we show up today. Because if the way I see it, if I'm not doing it, I don't really depend on too many other people to do it for me, though I do appreciate the research that has been done. Hopefully I responded to your question.
You did, thank you. One more comes up, and it triggered a reflection on an interview I think I did yesterday or the day before. And the person and I were talking about actually council member from 8th Ward, and I'll think of her name in a second. It'll come to me. But we interviewed yesterday, and she talked about the whole question of, the phrase over the summer of defunding the police, right? And she said one of the things, and it's relating to what you said, I think, Claire, one of the things that she thought about is Andrea Jenkins is the council member, vice president of Minneapolis City Council. One of the things she thought about in this whole thing of defunding the police, meaning move resources from the police department to other places that might bring a different, not a force-driven response to an individual or family or community crisis. But she said, you know what? You move it from the police department to the social workers. What's the history of the social workers in dealing with negative impact of the mindset of the community and how the community itself views and values or doesn't value Black life? And so you mentioned that a little bit. It caught my attention because you said that some of the things you'd seen in social work kind of mirrored or reflected the disinterest that people might be experiencing in the medical profession. Maybe I'm reading too much into that, but that's what I thought I heard you say. And I thought it was worth talking about. Am I on track or not?
Yeah, I think that's a great point. And I want to make sure I understand, are you referring to sort of the history of social workers and their role in communities of color, especially?
And not so much just social workers, but all of the institutions, all of the disciplines that we live with. And this is the interrelatedness of the failures in education, the failures in the economic system, the disparity and injustice there, the disparities and injustice in recognizing the cultural and artistic gifts that we bring to society. A pattern of exclusion and a pattern of marginalization that shows up in every discipline everywhere. So simply to point at the doctor is not really good enough, or even to point at the health profession is not good enough, because the systems that produce these responses are systems that exist in every element of our experience. That's what the point I was trying to make. Does that
definitely. Sorry, it was cutting out so much. I couldn't tell.
It's affecting us everywhere.
Yeah, definitely. No, I definitely agree. I think just looking at the implications of systemic racism, especially, and it's such a long history, and it's so much to dismantle. But I think we have to do it. We have to start with systemic change, and I think it's just a lot of different approaches that will have to be taken before we see some changes. But I think it needs to be acknowledged first and foremost. We have to look at the impact, and sometimes even the most well-intentioned plans still have an impact, and there's not enough, not as much focus on looking at what the impact is of the decisions that are made, whether it's in the criminal justice system or the healthcare system. And I really feel like a lot of times that's just because those that are affected are not at the table and a part of that conversation. So the way I see it, if we continue to collaborate with community members and those affected by these disparities, the more change we'll see, and hopefully more positive outcomes.
Well, I think we need heart-to-heart conversations. And that's what we're doing now. Let's close this program out with comments and reflections and maybe instructions from you, Dr. Courtney. Where do we go from here? What do we need to be doing individually, collectively, to move knowledge, awareness, and wellness, healthiness forward in our communities?
Absolutely. Thanks, Al. We actually, Batala sent me a question that we had related to this on Facebook Live, and mentioned the fact that, you're talking about preeclampsia being linked to heart disease and increasing your risk of heart disease. And that sounds scary. And I hope, to the conversation that we've been having, this is the opportunity to be inclusive, get the, VIP pass, or, to be a part of the story, in the sense that it does not have to be written in stone that you develop cardiovascular disease. And so, to me, the way I look at this as a physician is that, if you have a strong family of heart disease in a world, you're seeing either your primary care doctor or ideally a preventative cardiologist to figure out how to best be in the driver's seat of your health the way you want to, Dominique, holistically, whatever that means, to thrive, mind, body, and spirit. And so what we know, what I feel like part of why I care so much about the things that happen in pregnancy, this is a way to break the cycle for you and for your generations to come, of that it doesn't have to be cardiovascular disease. It's just you having the tools and knowledge at the very, very, very beginning to know, okay, now I know I might be at risk, and how can I best make sure that I don't end up that way? So I think, but to your point, it's going to take all the different layers and levels of, individually what we're going to do to thrive, but then how we do this to make it easy as a community and to pass it on to our brothers and sisters, the secret sauce, if you will. So, yeah, but I'm curious on your thoughts.
Well, listen, I think we're out of time right now. This has been a great conversation. Hopefully we'll continue this again in the future. I want to say a special thanks to you, Dr. Courtney Jordan-Baechler. Special thanks to our guest, Clare Rodrigues-Henderson. Thank you so much for your story, your clarity. Thank you, Dominique Wells. Thank you, granddaughter. I love you madly. Thank you for being here, and I'm so proud of you. Thanks to my daughter, Batala, your aunt, and who's organized this on behalf of the Insight Health Equity Action Lab. We call it iHeal. It's the successor to our Insight to Health Fitness Challenge. And thanks to her colleagues and partners, including Dr. Courtney at the Minneapolis Heart Institution and Heart Institution Foundation. I'm Al McFarlane. We'll see you next time.